Hi everyone, so this video is for people who have a child adolescent psychiatry rotation or are interested in child adolescent psychiatry, who just want to know what kind of different questions that we need to ask, as well as why we're asking them. I had another video on how to do intakes in general, that's about an hour long, that covers the other pertinent information for intakes. If you want more in-depth information on that, please go to that video. But this is just going to be the different other questions that we want to ask, why we ask them, and maybe some tips and tricks to how to interact with patients and do well in this rotation. So let's get started. So these are notes that I wrote down from my child adolescent rotations that I sent to third years, as well as notes that I've taken from other med students, as well as notes that I got from preceptors. So this is just an accumulation of things over the years, especially when you're doing an intake. A lot of this is important for a lot of different reasons. So first thing that we like to look at is developmental milestones. We really want to check that off just to make sure that to know if the patient had any developmental history or neurodevelopmental changes in the patient that are pertinent, right? So is there patients who might have autism, and understanding how that might be affecting mood and how that might be looking different from other psychiatric mental illnesses that might be presenting. So that's why we ask about developmental milestones, and then also knowing what services the child has or has been recommended for. So a lot of times at school, teachers or parents might request for something called IEP, which I forgot the name of. I should check that up. But IEP or other services to help the child if they're falling behind in school. If a pediatrician sometimes might recommend certain testing, psychologists might recommend testing. So knowing what has been recommended from different sources is always helpful as well. And if there is something that we can document to help the notes be more clean and clear. Prenatal history. This is important and a difficult question to ask sometimes. So for things like fetal alcohol syndrome, for example, might affect the baby's development, baby's neurodevelopment as well. So I always ask if there's any complications in history first to get some more information. And then I get into how many weeks was the baby born, and just explain to the mother that sometimes different substances possibly can also cause neurodevelopmental changes in the baby. It's just my duty to ask, was there any history of drinking specific drugs or smoking during the pregnancy at any time? And just ask it sensitively, because obviously you don't want to offend anyone, and a lot of people sometimes don't know that they are pregnant, and you don't want to make anyone feel guilty. The next thing we ask is, how are they at school? So for example, a lot of the bread and butter of child adolescent psychiatry is going to be ADHD. And ADHD requires a diagnosis from the parent and from someone at school, sometimes multiple people at school. And getting that information from the students, from the teacher, from the student, the patient, the teacher, and the parents kind of gives a holistic picture for that diagnosis. But it also helps us know for things like intermittent explosive disorder or oppositional defiant disorder, how the patient is behaving with other people at different environments, and could that be leading to a diagnosis? And then if they have siblings, how are they interacting with the siblings? Are they playing with the siblings? Are they behaving with the siblings properly? Are they harming the siblings at all? This is kind of hard, because parents might sometimes say they fight all the time and things. There are natural ways that siblings fight, but there's also, a spectrum of things. So make sure to get more into detail on what that fighting looks like. How often are they fighting? Who's starting the fights? Who's initiating things as well? It's very important. Then parents' history. So of course we know that psychiatric illnesses can have a genetic component. ADHD, for example, seems to have a genetic component. So asking for history from the mom or dad's side for any psychiatric illnesses or disorders are really important. If there's concern for depression or in general, it's always good to ask about firearms as well. Some of the medications that we use also can have some cardiac implications, QTc prolongation. So we always like to ask if there's any sudden deaths before the age of 30, 50, things like that within the family to make sure that we're not putting the patient at risk for any cardiac issues or exacerbating any cardiac issues. Past medical history for any patient is always extremely important. Make sure to always ask that as well. This question, are the parents still together? And do they have shared custody of the child? This is really important because if the parents are not together and do not have shared custody, or if the custody is split 50-50, 50-50, or even 10-90, whatever it might be, it's important to get both parents' consent to be able to prescribe medications to the child. So a lot of times, parents might come in and say, oh, I have 90% custody of the kid, but that still doesn't mean that you don't have to get the consent from the other parent because you don't know where that 10%, what that includes and what that entails. So this is something that's a little bit more difficult. As a medical student, please make sure to ask your preceptor, in what cases do we, how to handle cases like this, and how to ensure to respect both parents and respect the child, and to make sure there's no legal issues later on for prescribing a medication to a child without getting consent of both parents if they're needed. The next thing is parents' job and level of education. That's helpful just to know sometimes how much they understand about the medications and things like that. I usually don't ask this question too often because it doesn't give too much information for me, but it could. This is supposed to say things. And then things to ask kids. So always make sure to talk and interact with the kids. I think a lot of the times we focus on the parents because they're the ones with the information, but at any age range, if they're younger, make sure to talk with them. So sometimes you can get a really good amount of information from kids, especially if they're older. They can give you some information on what's going on as well, and it just helps that therapeutic aligns with the patient. So things to ask kids, especially if they're young, can they spell their name forwards and backwards? Can they spell the word computer backwards? I see that example. Simple math tasks, that's just to see where they are, if they're developmentally at the age range that they should be. Can they do complex tasks, etc. How are they liking school? Is there any bullying going on? How are they liking their teachers? A couple of things you can check here. If they're making good eye contact, if they're answering questions properly, if there's any situations at school that need to be addressed as well. Just getting to know the kid, asking what their favorite subject is, what their favorite color is. I've learned this from some psychiatrists. What's the saddest day of their life and what's the happiest day of their life? Just give some more insight. So if the patient is going through a loss of some kind from a grandparent or family member, you can see how much that's impacting them. Or if you need to build that therapeutic alliance, also asking what the happiest day of their life is as well. This can be done privately if there's any concerns as well, but are they feeling safe at home? Is there any concerns at home as well for any abuse or trauma or anything like that? And see if they can write and spell their name. That kind of goes at the top portion with being at the developmental place that they need to be. In general, I think the biggest takeaway is that in this situation, you're working with a parent, their kids, so please go in sensitively. Make sure to address both the parent and child, ask both of them questions. Really enjoy child-adolescent psychiatry by understanding what medication regimens we're prescribing and why, what are the differences, what we prescribe for OCD, for example, what we prescribe for medication management for children with autism going through maybe some mood disturbances, what medications we use to augment, things like that. Child psychiatry is really interesting. What theories are used developmentally to understand where they should be at. All of these things only help you understand child psychiatry better, as well as learn more about adult psychiatry, and it gives you the full picture of patients from there on out. So that's a little bit about child screening questions that we should ask. And then of course you need to ask the typical questions that we talk about in the previous intake that I did a video on before. It can be hard sometimes to be working with the parent and the kid, both of them might be talking. So just, be patient, be kind, and really enjoy it, because it's a field that I'm going into and I'm really excited about, and I hope you are as well. Okay, bye.